Goal! Let's take a look at Cristiano Ronaldo and figure out if he's had any facial plastic surgeries or is he really naturally that good looking. All estimated costs and a before and after photo are revealed later, so stay tuned. In 2003, at the age of 18, what I see here is that Cristiano has short upper and middle thirds of the face. He has a minimal nasal dorsal hump, and at baseline he has upper lip arching with upper tooth show on repose when he opens his mouth. Make sure to watch our video on what all models have in common to learn more about this phenomenon. Also, Cristiano has full lateral cheeks and the medial cheeks appear flatter. Notice his jawline at the angle of the jaw and pay special attention to the slope from the ramus of the mandible all the way down through the body of the mandible. We'll be coming back to that later on. In 2004, at the age of 19, what I see here is that Cristiano has temporal hair that has nicely framed his face. And this is a major part of male pattern hair loss, actually. When the temple starts to recede back, it's not so much that we're just getting the corners revealed, but also the entire face starts to look broader and the whole forehead starts to open up as the temples push back. But as you see in Cristiano's case, he has really nice anterior projection of those temples, giving him a very youthful look. As a side note, since 2019, Cristiano Ronaldo actually co-owns a hair transplant clinic in Spain. I found that interesting. Ronaldo also has a prominent masculine brow bone. I just want to remind you that we have a weekly newsletter that talks about hair loss and offers information on hair restoration. Be sure to subscribe to it at hairlinesnews.com. In 2005, at the age of 20, Cristiano has full tooth show on smiling, and it's clear that he's had a full smile makeover. He's had a series of veneers placed, and when you compare back to 2003 and 2004, you can really see what a major transformation has occurred. In 2006, at the age of 21, I don't see any changes, and this is the same through 2009. In 2010, at the age of 25, the major change that I see here is that I think Cristiano may have had upper and lower jaw implants. It's likely that there was a malar cheek implant placed as well as a gonial angle implant. It looks to me like he's had a filling in of his medial cheek volume deficit. Now, could he have had filler instead? Sure, that's always an alternative option for filling in the cheek area, but it looks to me like the appearance of the cheeks look about consistent throughout the years to come. So I think that it's possible that he may have had an implant. Also, when you follow the ramus of his mandible down through towards the body of the mandible, what you will notice here is a contour change. It looks to me like there is a lateral bowing of the area as you reach the angle of the mandible. Compare that to prior, where the overall slope and contour appears to be bowed in. Now there's a bowing out of that area, and so that to me is a major change in Cristiano's face. He may have had a off-the-shelf type of implant where you just buy a pre-made type of implant that matches the overall shape that you're going for, but he also, given his resources and given his status, he may have had a custom 3D type of implant that's prefabricated based off of a CAT scan to actually fit the face as perfectly as it possibly could before you go in for surgery. So you have this custom type of implant that then gets placed into the area right over the jaw. Thank you for subscribing to this channel, and if you haven't already, please make sure to subscribe and turn on all notifications. When it comes to facial implants, the incisions that are used for placing these implants are usually done on the inside of the lip, both on the upper lip to get to the maxilla or the upper jaw, and on the lower lip to get to the lower jaw. And so you're not going to see any scars from the outside. You'd have to really raise up the lip or lower the bottom lip to be able to see where these incisions were placed. So it can be very difficult to detect that someone's had this type of work done. Also, the question becomes, well, why even get these implants? I mean, what's the purpose? Is there a functional purpose? Not really. Is it just for aesthetic gain? Pretty much. The thought is that if your jaw is a bit more prominent in the angles, and if the upper jaw has nice fullness to it, you'll look less tired, you'll look more youthful, and also more masculine. So that is most likely why, majority of guys who are getting these type of implants are doing it in the first place. I find it interesting that around 2009, 2010, Ronaldo actually signed for Real Madrid in a transfer worth 94 million euros. Could these potential procedures have corresponded with his growing popularity and worldwide fame around that time? Let me know what you think in the comments below. 2011, at the age of 26, I'm not seeing any further change. Same in 2012. Compared back to age 18, you can see that in this photo from 2013, the outline of the potential malar implant is quite visible. In 2014, at the age of 29, it looks like Cristiano may have started on Botox to the forehead, the glabella, and the crow's feet. He now has smoother skin to pair with his effective skincare routine. Now, when performing Botox for men, you have to keep in mind that the muscle that you're injecting into, in the case of the usual locations, right, the frontalis muscle for the forehead, the corrugators for the glabellar area, and the orbicularis for the crow's feet, they're usually stronger in men, and typically what that translates to is more units of Botox for the same effect. So it's very common when a guy comes in for Botox, he would typically get underdosed by a clinic that is performing a lot of Botox, say mostly on women. So there has to be that dose adjustment that occurs so that the muscles that you're seeing on men, especially men who are using their muscles quite often and athletes, need to be dosed properly to get the same visual impact. In 2015, at the age of 30, I'm not seeing any change, and that is the same all the way through 2022. The total cost of Cristiano's potential procedures is $140,000. And here's a before and after. Since you like this video on Cristiano Ronaldo, I know that you'll love our video on David Beckham. Click on the card and I'll see you there.